Thank you. Thank you for the very kind introduction, and salam alaikum. I'm honored to be here and to give this presentation. The title, I think, speaks to what open source is really about in healthcare, which is open innovation and transformation of health systems. We talked a little bit about money and how money is an important factor in this. But ultimately, what's really powerful about open source in healthcare is its power to transform and how it mimics the natural innovation process that's already part of medical systems called evidence-based medicine. So I'll try and get that message as the primary message for my presentation. So briefly, the agenda. I don't think we have this working. I think you're going to have to watch from the sides. I'm going to talk about why we need a paradigm shift in healthcare, why we need a different model of e-health for software and so forth. I'm going to explain briefly why open source is a natural fit for healthcare systems, why the process of open source is so synergistic with innovation processes in healthcare. And then I'll give you some evidence. I mean, it's nice to talk about open source and so forth, but where's the scientific evidence that shows that open source really is a powerful new model for evolution in healthcare? I'll provide an overview of some open source solutions in healthcare. There are many now. I've been in this for over 12 years. I can tell you there are now literally hundreds of applications and components that are open source for healthcare. And then briefly at the very end, just talk about possible next steps. So why do we need a paradigm shift? Well, one of the chronic symptoms that we've experienced in the developed world, in North America and Europe and in other places as well, is it continues to be very difficult to share medical information across health systems. It's okay to, in one facility, in one hospital, in one clinic, and so on, you can share information because you have the same system. But across multiple systems, when you start looking on a national scale or a regional scale, or even on a city scale, it's very difficult to share information because of proprietary lock-in and other factors related to proprietary development. Consequently, it's really hard to measure what the return on investment is, both in terms of clinical return on investment. In other words, we're improving the health of our people, and the financial return on investment of health IT, because we cannot aggregate the data that's essential for making that kind of analysis. And consequently, we don't know whether we're making the right decision when we select software. And it often takes many years before we find out we made the wrong choice. It's not about the money, it's about the health and human opportunity cost that entails. Because what happens is, if you put in systems that aren't effective, you are actually affecting people's lives. The other factor is that we're experiencing reinvention of the wheel everywhere. Ultimately, healthcare and human beings are the same everywhere, and yet we're not learning from each other very effectively. And partly that's because of competitive strategy and proprietary lock-in and so forth. We talked about the price tag. I can tell you that trying to glue together the very different systems that we have in Canada, which is where I'm from, or the United States and Europe, the price tag is very high. In Canada, we have a population of 35 million, and the government is saying it's going to cost us in the order of 20 to 30 billion Canadian dollars just to provide the integration. And yet there's no proof that we can even do that yet. But the most important thing, and this is where the biggest message I want to leave with you about open source, is that it's very difficult to establish evidence-based feedback loops in national health systems or local health systems with proprietary technologies. It's not impossible, but it's very, very difficult. And I'll explain what evidence-based feedback loops are in a moment. So we've had some expensive lessons. I mean, Canada, we've had a couple of billion-dollar failures in the province of Ontario, where I live. We've had a provincial health network initiative, which has been going on for almost 10 years. and has spent over $1 billion, and all we've ended up with is a secure network. We don't have any integration of any of the information systems. There's similar failure in the province of British Columbia. Our colleagues in the UK in the NHS Connect project, which has been multi-billion dollars or multi-billion pound initiative, that project was recently killed and has been a failure. Hopefully our friends in the US will not make the same mistakes. They're about to spend close to $27 billion as part of the Recovery Act in the adoption of healthcare technology. So the key point here is that we can't solve the problems that we have today at the same level of thinking that we had when we need a paradigm shift. And open source presents or provides that paradigm shift. So why is open source such a natural fit for healthcare? Well, healthcare systems are natural systems. They're complex adaptive systems. They evolve from the bottom up. They're not linear. I mean, when you go to a doctor and you present with a problem to the physician, it's not always apparent what that problem really is. I mean, you may have a sore throat. It could be multiple factors. You could go into the hospital for surgery, for example, and end up having other procedures and so on done. So it is a nonlinear process, and it evolves much like natural health or natural systems do in the environment. So we need a different way of looking at health systems. We need to look at them holistically, and we have to look at them from a patient-centered focus, from a human, citizen-centered focus. And there are a number of different elements to the health system. There's a health delivery, which we're all familiar with. There's also research. There's also proactive care in terms of wellness. There's education. And all these components of the health system interact like an ecosystem does. And it's important that the information systems and technologies that we use reflect that kind of integration, that kind of systemic environment. And as I said, it's very difficult to create these kinds of systemic integrated environments with proprietary technologies. So open source provides that kind of framework. It is open, it is collaborative, and most important, it is very similar to the kind of evidence-based open innovation and research model that already exists in healthcare. If you want to find out more about evidence-based medicine, just Google the Cochrane collaboration, which has been in existence for many, many years, where physicians, researchers, and so on share their clinical research in order to improve the knowledge of medicine. Well, what we're doing is, in open source, is literally applying that same paradigm, that same model, to the evolution of software and improving software so that we can treat people more effectively and so we can have better outcomes, which is really what it's all about. It's not about the money. It's about getting better quality of care for people, having people live longer and better lives. I won't, since we're running out of time, I'm not going to talk a lot about this slide, but the most important thing is the last point, which is open source provides a much more rapid evolutionary process for innovating health systems, and that occurs at multiple levels. It occurs at the software level, it occurs at the business process level, and it occurs at the knowledge level that supports healthcare. That cycle of improvement runs all the way up and down that whole model. And in addition, we can target innovation more effectively to where we actually need it. We don't target innovation in open source based on profit incentives and so forth. We target it based on what is needed by the end user. So you might ask, okay, so these are all interesting ideas and so forth. And open innovation can be seen as a catalyst for improving outcomes and so forth, but where is the evidence? There are multiple organizations that have been adopting open source. The VA was mentioned, the Veterans Administration, and I'm actually going to focus on the Veterans Administration, but there are others. The McMaster Department of family medicine in Hamilton, Ontario, which is one of the leaders in evidence-based medicine, and the Cochrane collaboration itself has been using open source for their primary care electronic health record for over 10 years now, and that system is spreading across Canada to many provinces. But I'm going to focus on the VA because it's probably the best benchmark that we have, the best scientific benchmark we have in health systems, because they've been actually practicing an open source kind of process for over 20 years, and we didn't call it that 20 years ago. But essentially that's the methodology that they've been applying to the delivery and improvement of care, as well as the software. It's been studied in many peer-reviewed studies. There are many journal articles about the VA and the work that's been done in the VA and the work with Vista. As I mentioned, it's an evidence-based ecosystem. It's 99% open source in its clinical applications. The VA doesn't use, they use a proprietary database to run Vista, unlike Jordan, which uses an open source version of the same database. But at the application level, 99% of the applications are open source. And the other thing that's interesting is the VA looks more like health systems around the world than it does like most of the health systems in the United States. It is a more similar model in terms of how you look at payment and so forth. Dr. Ghassan mentioned that it's the largest medical system in the U.S. To give you an idea, there are 5.3 million patients in the system. There are over 180,000 doctors and nurses that work in the VA system, 163 hospitals, and so on. The other interesting thing is that there's a very strong affiliation between the VA and the medical universities in the United States. There's a relationship with over 152 of them, and over 70% of people that are trained in healthcare, doctors and so on, rotate through a VA hospital as part of their training. So there's a lot of exposure to Vista in the U.S. health system. But more importantly, it again reflects that model that I was talking about, where you integrate research with care and with wellness and so forth, because it brings in the research element as well. Vista has been, as was mentioned earlier, has been developed over 20 years. There are over 100 applications that create Vista, that are integrated to form Vista. And it's used across the entire VA health system, which includes clinics, nursing homes, and hospitals. So it's a full, it reflects the entire ecosystem of care. And something that I should mention as well, the typical patient population in the VA is a very complex case. They often have multiple problems. They tend to be middle-aged to elderly in their age profile and so forth. So you're dealing with a typically very difficult and expensive patient population compared to what you'd see in a normal patient population. To give you an idea of usage, and these are 2006 statistics. I'm sorry I don't have anything more recent right now. But there are over 600,000 documents, such as progress notes and discharge summaries and so forth, generated in the system. At that point, there were close to 1 billion documents in the system. Orders, Vista has fully integrated order entry results reporting. That means if I order a medication or I order a lab test, that goes electronically to the pharmacist or to the lab and comes back to me on my system. I never have to touch a piece of paper to actually see the results. There are over 1 million orders done processed each day as of 2006. I'm sure that's higher now. There are over 750,000 images processed each day, vital signs and so on. You'll get a copy of these slides so you can read the statistics themselves. So the point here is that it's a highly scalable system. It is a mission-critical enterprise quality system. It's a huge transaction processing load, and it's very, very robust. So now let's look at some of the evidence. I said that's just sort of give you some background. The VA is a good example of the application of open source and so forth in health. So we're going to look at it from a couple of perspectives. The first one is the clinical evidence. How has this actually improved the quality of care and outcomes in the health system? Well, VA, one of the first examples, and I'll give some general examples and then I'll drill down and give you some detail and actually show you. It's unfortunate this screen isn't working, but I'll show you some examples of how you can use Vista to actually get at this kind of a result. One of the key things, the low-hanging fruit, one of the low-hanging fruit in health systems is eliminating medication error. And the VA is one of the pioneers in doing this. In fact, it was a nurse who was coming back from a flight in the United States somewhere who, when she was getting her rental car processed, they scanned the barcode on the car and they produced her bill right beside, her bill was paid for and so forth right at the car as she was about to leave. This was about 8 or 9 years ago. She took this idea to the developers in her hospital and said, can't we use this to improve the way we deliver medications in order to make sure that we give the right dosage to the right person at the right time and so on. Because medication error is a huge area of potential inefficiency and so on in the health system. In fact, in the U.S., over 100,000 people a year die because of medication error. So they were actually able to implement this. And literally, almost overnight, once the system got across the entire system, the entire VA system, they were able to reduce medication error by 99.99%. Another area that takes longer to experience the impact in terms of quality improvement is supporting preventive care or chronic disease management more effectively. So preventive care like immunization, just making sure that you're giving people who are at risk the right immunizations at the right time and so forth is extremely important. And that kind of quality improvement is done through a mechanism called clinical reminders, which I'll show you an example of in a moment. And the VA went from being able to only cover 35% of their eligible patients to over 82% by 2003, as an example. I mentioned chronic disease management. That's a very important area. There are problems like diabetes and hypertension, which if you manage them effectively, they prevent having more serious consequences and problems. And that's important, both obviously from the individual standpoint, but also from when you start multiplying that across the health system, that becomes a very, very big problem that can be easily managed or more effectively managed if you have the right kind of health system to support it. Well, you won't. This is a bit of an eye chart, but again, when you get the slides, you'll be able to read this. The VA gets measured on about 20 or 30 different independent objective measures by external agencies, and on those measures, it consistently outperforms all the health systems in the United States. In fact, over 85 to 90% of these measures, the VA is number one in terms of effectiveness. Things like screening for breast cancer, cholesterol screening, and so on. Again, looking at this slide just presents a more specific example relating to diabetes and testing for diabetic care and so forth. And again, the VA is outperforming the private sector. And one of the reasons that they're able to do this is they're actually able to measure, because of Vista. Remember I talked about having the right information to measure the return on investment and the quality of and the outcomes and effectiveness of your systems. Well, the VA can do this because it is a fully integrated health ecosystem. And this slide just shows an example of a dashboard that is used both at the the local hospital level and the regional level to visualize what's going on literally almost on a real-time basis in terms of the quality of care. And they're able to take that information and then go back and look at what they were doing. So for example, if one of the hospitals is outperforming another hospital on diabetic care or on some other measure, they're actually able to then diagnose what the reasons for that are and then take that lesson and apply it on a national scale. And that's that evidence-based feedback loop I was talking about. It's the ability to measure your outcomes scientifically, understand what went into that, and then to be able to transmit that and make that part of the process of care across the entire health system. So I'm going to show you very briefly through slides how that's done. Again, I apologize that you can't, all you'll be able to see is a little picture on the screen. But what you're looking at right now is essentially the dashboard, the patient dashboard that the clinician and the nurse would see. This is CPRS, it's the graphical interface into the patient record. You can see the entire patient record for an individual in there. And right in the middle of the screen, there's a box that is focusing on clinical reminders, which is, I'm just zooming in on it in the next slide. And what clinical reminders do, basically they look at the patient profile. If you're a diabetic patient, what will come up are a bunch of steps or processes or a protocol that says for diabetics you should be doing creatinine tests, you should be doing HbA1c or retinal exam, and so forth. If you're a certain age profile, in this case the patient is of probably reached the age of 50, you should be screening for colon cancer. So what are these things? It's basically a checklist that's based on the best scientific evidence, thank you, that tells you what you should be doing in order to provide the best quality of care to that individual. And essentially, what's going on here? Oh, sorry, I just hit the wrong. So the system guides the
You have only 2 minutes.
It guides the physician through it basically provides a decision support system to provide the best possible process for caring. So I'm going to skip through that. It also allows you to understand what the evidence and so forth is for that process, because it links out to the internet, excuse me, to the actual evidence that's being used. So the bottom line is that because of this, the VA was able to transform itself from literally being one of the worst health systems in the United States to now being considered one of the best. And at the same time, its patient population increased dramatically, and the complexity of its patients increased, and its budget did not increase. So I just have a couple of minutes to wrap up here. There are a number of very high-quality open-source electronic health records and technologies available now in health systems. In addition to VISTA, there's OSCAR, which I mentioned from the Department of Family Medicine at McMaster University in Canada. There are personally controlled health records. There's the Indivo platform and MyOSCAR, which are both, MyOSCAR was developed by McMaster, Indivo by Harvard, MIT. MyOSCAR actually uses the Indivo platform. In imaging, we're going to hear from Andrea about O3. Osirix is a DICOM viewer. There are integration platforms like the NHIN Direct platform, the MIRTH integration engine, and so forth. And what we're seeing now in health and open source is that it's more than just the infrastructure. It's more than just the operating system. It's more than just the application. We're beginning to see collaboration occurring across the entire spectrum through knowledge bases, process innovation, and personal empowerment through health records, personal health records. So what's the opportunity? I think in terms of next steps and opportunity, it would be valuable to look at establishing open source and electronic health record education is part of your medical informatics training and your clinical training. You should be looking at something to think about is a regional open source e-health interest group. We have Jordan, my colleagues in Jordan, who've taken the lead, I think, in this region. But as we've talked about, it's a collaborative thing. We should be looking at exploring the possibility of collaborating on standards and terminology and knowledge bases. And understanding where the low-hanging fruit is in the health system, because that's where you should really start if you want to apply the technologies. And I'll stop there. Thank you very much.
Thank you.